Hey guys, it's Lily. Today we're going to be talking about beta blockers, SSRIs, which are selective serotonin reuptake inhibitors, but we're going to say SSRIs, and my experience with both of them. All right, let's talk about it. So, when talking about beta blockers, for this specific info dump, I'm going to be using the British Heart Foundation. And usually beta blockers are prescribed for heart and circulatory diseases like high blood pressure, heart failure, or irregular heart rhythms. And sometimes they're used as anxiety management, which is why I was prescribed them to manage anxiety. How do beta blockers work? They actually block the effects of adrenaline or noradrenaline, which slows the heart rate and reduces the force of heart contractions. So it actually prevents the physical reactions of some heart problems or anxiety. So obviously, anxiety is mental. It starts mental, you start to get worried about something, but then it turns into uncontrollable anxiety or an anxiety attack when you start having the physical symptoms and you can't necessarily regulate them. So your heart, you essentially go into fight or flight, and the beta blocker forces the physical symptoms to stop. Um, Examples of beta blockers are ethanol, bisoprolol, carvedal, metoprolol, neprivolol, and propranolol. Propranolol is what I have. Um, Benefits of beta blockers include the controlled heart rate and rhythm, obviously, reducing chest pain in patients with angina, lower blood pressure, and it prevents further heart strain and long-term cardiac complications. However, there are side effects, of course. Side effects include fatigue and tiredness, cold hands and feet, dizziness or lightheadedness, sleep disturbances, and occasionally sexual dysfunction. When taking them regularly for some form of heart disease, you're not supposed to stop suddenly because stopping abruptly can cause rebound hypertension or other heart problems. For me, I was prescribed them for situational anxiety. So I am directed to take, I have my pill bottle. I was directed to take a half a pill when I start to have an anxiety attack. So it will significantly reduce the physical symptoms so that I can kind of recenter myself. Um, but I don't have to worry about like stopping suddenly because I'm only supposed to take it in those situations, which hasn't happened yet. And I have been off of my medication, off of my SSRI for 2-3 months, maybe longer. I don't know. When my psychiatrist prescribed it to me, she was like, I'm going to give you this amount of pills, but you're only taking a half a pill. So this will probably last you like 2 or 3 years. So I don't really know how much she planned on me taking it, but like when they're used for anxiety, obviously it lasts a lot longer because you're not taking it regularly. So SSRIs, or selective serotonin reuptake inhibitors, are a type of antidepressant. Um, they are FDA approved for depression, anxiety disorders, OCD, PTSD, bulimia nervosa, and PMDD. Obviously, there's a wide variety of types of SSRIs and what they specifically target in your brain. So that was just some general things that they can be used for. Um, SSRIs work by blocking serotonin reuptake in the brain, which allows serotonin to remain active longer in your brain. So, increased serotonin levels help regulate your mood, sleep, and emotional stability. Some common SSRIs include Prozac or Serafin, which is fluoxetine, Zoloft, which is citrulline, and Clexa, which is citalopram, Lexapro, which is escitalopram, Paxil, Paxil CR, or Paxiva, which are all paroxetine. And obviously there's a ton more, but those were just examples. I was on Zoloft. I think I was on, when I was much younger, I was on something with a P. I think I was on Prozac when I was a lot younger. Um, so obviously depending on your other medications or your direct need. You'll be on different ones or would be on a different one. Sometimes the dose changes. Sometimes you just don't interact well with one. It's medication. Who knows what happens? Benefits to SSRIs obviously include the support of both mood and anxiety disorders, and they're often used alongside cognitive behavioral therapy for better results. They're also supposed to have, modern SSRIs are supposed to have fewer or milder side effects than older antidepressants, such as tricyclics. But common side effects do include headaches, dizziness, nausea, stomach problems, dry mouth, sleep disturbances, weight changes, and sexual side effects. Um, those are just common side effects that most people experience at least one when they're first getting on the medication. I know when I first started, the first like 3 days, I was like hardly hungry. And so I wasn't eating as much. And I don't think I lost a significant amount of weight. I just know I didn't feel my hunger cues the way I normally do. So I know I wasn't having as many snacks at that time. But it kind of like balanced back out after a week or two. For more serious risks with SSRIs, there is the risk of serotonin syndrome, which I'm going to talk about a little bit more, discontinuation syndrome, which includes flu-like symptoms, headaches, irritability if stopped suddenly. QT prolongation, which is a rare heart rhythm change, but that's a little more rare. And then increased suicidal thoughts in people under 25. So there is, when you start a new medication, you are specifically directed to like meet with your psychiatrist a little more often or your therapist a little more often to kind of check in on how it's going, especially under 25, because obviously this is messing with the chemicals in your brain. And so for some people, one medication might actually make their depression significantly worse. Whereas they're like, okay, let's take you off this SSRI. Let's put you on this different SSRI with a different chemical balance, and it works. It unfortunately does take a lot of trial and error for most people to get a good balance of medications. I was always told, I mean, with SSRIs, generally speaking, the most important things are to avoid alcohol and do not stop them suddenly. Stopping suddenly, obviously, everything we just talked about, it adds chemicals to your brain, so you're going to be thrown off. Your brain's going to be a little messed up. So you typically wean off of them and meet with someone more regularly to talk about how it's going. As for the alcohol part, alcohol is a downer. So it can worsen your depression, increase sedation, and reduce medication effectiveness. When I drank while on Zoloft, I didn't notice any significant mood change besides like just being drunk. I do think I got drunk faster though. However that interacts. So do with that information what you will. Serotonin syndrome was something I hadn't heard about, but as I was researching, saw that being a risk with people who are on SSRIs for a longer time period. So serotonin syndrome is when you have too much serotonin in your brain. There are a few different ways this can happen. This can happen with overdosing on a serotonergic drug or combining multiple serotonin boosting medications like SSRI and MAOI or SSRIs and triptan, or mixing SRIs with certain supplements or recreational drugs that are supposed to boost mood. So, like smoking St. John's Wort, MDMA, LSD, taking those things while also taking an SSRI puts you at risk for serotonin syndrome. And so, what happens when you start to experience serotonin syndrome? Serotonin also, with your mood, obviously, it also helps regulate your movement and body temperature. So when levels are too high, it overstimulates your nervous system, which can cause neurological, mental, and physical symptoms that include agitation, confusion, tremors, muscle stiffness or twitching, sweating, shivering, rapid heartbeat, high fever, and in severe cases, seizures or loss of consciousness. If you start to feel some of those things, or even you're on an SSRI and you go to smoke and you don't realize how strong it is and you start to feel some of those symptoms, you are to seek medical attention immediately because it can escalate so quickly with the imbalances in your brain. So, reflecting a little bit more on my experience with these things, I began Zoloft in spring of 2023, and I started at 12.5 milligrams. So, I was prescribed a 25 milligram pill, which is like a baseline dose. But for the first 2 weeks, I was told to take a half a pill every day to kind of introduce the chemicals to my brain. And then after those 2 weeks, I increased it the full pill, 25 milligrams. After about 3 months of meeting with my therapist and psychiatrist, we did decide to increase it because I was still struggling with some things. So it was the lowest dose. So we did increase it to 50 milligrams. So after the first month or two of taking medication, I noticed a general anxiety relief. Like I didn't have as consistent of anxiety, but I was still kind of having a lot of unprompted anxiety issues. So after 6 months of medication, so 3 months on 50 milligrams, 6 months of total medication, my anxiety was much more well controlled, and I wasn't having any unprompted, uncontrollable anxiety attacks anymore. I did have some appropriate anxiety, which was necessary because that's human life, but I didn't have any uncontrollable anxiety, which was the goal of starting medication. After about 2 years, I decided I wanted to come off of it because I started to look into some of the long term things, and I felt like I was in a position where I could better address my mental health if something were to happen, or if I were to go back into kind of like a constant state of anxiety. I am in a position where I was able to address it more comfortably, and kind of work through that. So after 2 years, I decided to taper off. And the tapering off process was I had 10 days at 25 milligrams. So I was on 50 milligrams for 2 years. I had 10 days of a half pill. And then after those 10 days of a half pill, I had another 10 days of taking 25 milligrams every other day. After 5 days of starting to taper off, I had some really bad migraines. I would wake up and it would kind of be like, okay, but then it would slowly get worse throughout the day. And by the end of the night, the only way I like wasn't in serious pain was standing in a hot shower with the lights off. So for like 3 or 4 days, I did that probably for like an hour at the end of every day. But then it did start to get better. Like the headaches didn't last as long, or they weren't as bad. And after about 2 weeks, I was considered myself completely symptom free. In the process of tapering off, while talking with my psychiatrist, I had mentioned I might want to get a renewed prescription for my Concerta, which is an ADHD medication, because I was concerned that coming off of my anxiety medication for generalized anxiety, if I go back into situations that I know would induce anxiety, because I would be overstimulated, or yeah, I would be overstimulated. I was like, okay, but if I take my ADHD medication, I'll be able to better manage my brain and be able to prevent some of the anxiety. And she was like, no. And I was like, what? And that's how we ended up discussing those different things. And she was like, we're going to give you a beta blocker because you can go into that situation and live the life you want to live. Oh, good Lord. You can go into that situation and live the life you want to live. And then if you start to have uncontrolled anxiety, then take a medication. If something happens, have a medication. Don't have a medication and anxiety of something happening. So that's when I then got a beta blocker. That was a lot of information. I don't know. There's a lot of research out there about how good SSRIs are for short-term treatment, short-term like a year or two, like going through a grieving process or a divorce or like some major life thing where it makes sense to be depressed. And then if it starts to become clinically depressed, you can't do life, take an SSRI, address the problems, work through it, but then taper off. The problem with if you don't taper off, there's a chance you become reliant on it, your baseline is kind of reset to what it is with that medication. And so then you start turning into a 20-year-old taking 50 milligrams into a 30-year-old with 100 milligrams plus two other medications to balance everything. And so you kind of keep having to add until you get more and more. There's a lot of videos out there on that, on having to balance medications and building tolerances to SSRIs and long-term side effects. I might do another deep dive into it, but I haven't yet looked at peer-reviewed sources. I've just done a few YouTube videos which encouraged me coming off of it. So I might eventually do a deep dive into that. But this was just a general, what are SSRIs, what are beta blockers, and my personal experience with them. So yeah, let me know what you all think. Like and subscribe. What do you want to talk about next? Drop it in the comments. Bye!